to a lot of dentists, the business model of dentistry and where it's going, what it is now, and where it's been. Probably
How
not in that
it,
we'll talk
yeah,
about.
and let's talk about how it fits in with healthcare. We
Absolutely.
really have to just keep imagining that our silos are built with a permeable wall so that you can see through and that you can get through, particularly the thoughts, and how things can progress and how things can move forward.
One of the things that I see, and we know it's there. I call it junk thinking, but it's really overregulation. We can't even breathe anymore. Look at the equipment that we have to wear in an environment that we were pretty much. I mean, I've been in this industry long as you, 30 years, and I'm still around. I haven't lost fingers or toes or eyes or noses. And I mean, I began practicing with no gloves and no mask. And yeah, and you just washed your hands with a special soap, and you took your breath mints, I guess. But I'm telling you, I feel for these newer hygiene sisters, it's like going to battle, and it's a bacterial germ they're battling against. It's and the system is so overregulated right now with fear of what is it?
Everything.
Yeah, and that's why you have hygiene burnout. I can see it why there's such a shortage of dental hygienists. And I recently heard that foreign dentists are coming in now and taking those dental hygiene jobs taking over, and because of their licensing, they're able to do some, occlusal fillings and some small restorative type appointments.
Depending on the
And
state, obviously.
yeah, so where in the business model in any kind of healthcare system do you skip over assessment and skip over investigation and just dive
Right.
in and treat the person? I mean, come on. This is the 20 something 2025, and with all of the technology, they're not even paying attention to looking first before they dive in and slice and dice. And we know the neurology in the teeth is connected with the brain. That's a whole nother topic we'll talk about in another podcast. But right today is that business model it's the swamp. In my opinion, it's so archaic. And one dentist out of another country said America has three types of dentists. The first type is the bacterial dentist. The second type of dentist is the one that wants to expand. And then the third is the dental physician. So we looked at this business model. Where do you think the percentage, Shirley, of the bacterial dentists is in our
Probably
United States?
99%.
99%. Okay, thank you. Any comments?
Well, I don't know. It's just the education is very behind. Looking at what's been happening with the government right now over this last couple of weeks since our new president took over, and this whole Doge thing is just exploding. The coding and the covering and the curtains that everyone's been behind. That's exactly what's happening in all of education. And if we're just going to talk about medical health, medical education, and dental hygiene education and nursing education, it's the same thing. It's these people who have a lot invested in not changing their mind and keeping everything the way that it was.
Tradition.
It was
Yeah,
like that last year, so we're going to do it again this year,
right.
and it leaks over into the practice of all of these things. I know for myself, and I've never talked to, well, maybe one person um, who would recognize that a patient has been seen at that practice for a number of years, and they've just been skating along. We used to have one line in the treatment notes. Remember that? EX, PX, BWX. That
That's
was
right.
it. That's all we did. And it was $28 or something like that. And then that's
Right.
what that's
Yeah,
what our notation was.
that's
And
right.
so
Yeah,
now, which you could do that in a half hour, 40 minutes, right? You don't have to
right.
do any charting. Doctor's notes say needs crown number 18, and then away you go. And so we have a lot more to write and all of that stuff. So, but what's not happening in the schools is moving the needle forward to how it is that we are currently practicing. We
So they're
are,
right. So they're not up to date. That's what
well,
they're
they think they are. And I don't know about you, but I thought I was a cat's ass when I graduated hygiene school. I was like, oh, you 20-year hygienists, you're so behind the times. And what I see now of the
yeah.
graduates from everywhere, dental graduates, medical graduates, all of them, they're all the same. They all have a necessary attitude that makes them appear to have in their mind that they are superior to pretty much everybody else. That was intentional from the schools, I think. But they're really only barely safe beginners. That's how you get a degree. You just
So
are able to not kill people.
they're glorified technicians is what we're seeing graduated. And the thing is that where's their I see some of these dental hygienists and I've worked with them that uh if they've gone they have to have their prerequisites to get into dental hygiene school. But for some reason, there's a few of those prerequisites aren't taken or necessary. And these are the sciences. There's a big gap in the science. I took so much science. I was with
Right?
the pre-med or the pre-dent students, the pre-nursing students.
You were in a
I
university. I was in a technical college.
did you get the science? Because I got the
I
science.
don't
I
like
got
the
a ton
science,
of
but I
science.
thought it was very soft. I was already 2 years in a university environment, a state school, and then I transferred into this technical college, and I was like, really? Because I even had to correct a couple of the instructors.
Yeah.
That's really uncomfortable. It's like seriously uncomfortable to have to do that, um, and do it without like you know. So you were
I
with
think they,
dental students. I was
well,
not at
right.
all.
And to get into a university environment, they had this um uh expectation that you were a scientist first. You were science thinking first, not and then your task is second in place. But first use your brain and really think about what it is you're doing for this person.
Critical
Yes.
thinking and professional curiosity.
Yes, that's what was instilled in my training, and our program director was emphatic about instilling that in I graduated from Idaho State University, and they were emphatic about your science and your yes, critical
Yeah.
thinking and curiosity. And she said, we can train a monkey to clean teeth,
Yep.
but we're going to train you why you're a dental hygienist.
Yeah.
And I never forgot that because she was very emphatic and very clear about we can train anyone to do the technology, but you're going to be a professional. And what I see is some of these junior colleges are missing that professional training and critical thinking and where, because there was such an influx of need of dental hygiene positions, the 2-year colleges took on those courses and I think dumbed us down in a way in the expectations of where your profession will go after graduation. So maybe that's where we start. I don't know, but
Has to
or
be part of the solution, but that's a
yeah,
long tail. That is going to take some time. Probably the biggest example of how archaic our thinking is and how we're not keeping. I got two really good examples. One
sure,
is during COVID, how everybody was all twisted up about aerosols, like we've never had aerosols before.
right.
And I'm like, dude, there were aerosols 2 weeks ago and you didn't seem to be worried about it. And there's crap in those aerosols
Oh yeah,
that were the exact same crap as they are right now.
right.
Nobody did pre-procedural rinsing, which even with water reduced the bacterial load in the aerosol by 70, 80%. I mean, it was really high. And
That's
if you just use regular yellow Listerine, you can reduce that aerosol toxins by
Mhm.
98%. And then people were starting to do it a little bit because they were so afraid once they got to go back to work. And then I started to see on Facebook, when can we stop doing this pre-procedural rinsing? It's really just blah, blah, blah. I'm like, it was just so irritating and so frustrating. And then periodontal charting is also a very good example of how legacy education just keeps on keeping on. If you ask a hygienist to not do periodontal probing, the real ones will be a few, and then you have the ones, and they're like, oh my god, it's the most important thing we ever do, la la la. All it does is it moves chunks of biofilm from infected areas to non-infected areas, and you're moving the disease along.
Well, do you
With
hear, yeah, do you hear
It's
what you're saying?
unreal.
Lack of critical thinking.
Go.
So what they're used to is their task, A, B,
Yes.
C,
Mhm.
A, B, C. We come up, we disrupt the task procedural and with critical thinking, and
Yep.
there's an ice block. I see deer in the headlights,
Yes. Yes.
and I see why. Why do we have to do it differently? Because we've done it A, B, C.
That's
And
exactly what happened in this Facebook group. I was like, why are you perio charting? And
right.
one little tart underneath was like, well, she's probably not a hygienist. I was like, I was just like, ugh. I waited to respond and I still couldn't get away without using the F bomb. So I was like, if you're not wondering why we're still perio charting in 2025, then you are lacking in critical thinking skills. And that's kind of where I took off here, is that every 5 years, I would look at each patient as a brand new patient. I would take them through a new health history. I would do a new full mouth series of x-rays or panoramic or whatever, update their full x-rays. There was stuff in there that we had forgotten about or we had ignored or whatever, but the patients had better outcomes, and
Well,
everybody should do that.
what you're saying is, in a way, dental nursing. And that terminology, that
I
term
don't
was,
know. Dental nursing,
no,
I don't
let
know.
me finish.
Yeah,
That,
yeah.
they were
Okay.
putting that out. It's, and I say, I don't think that it should be used, that term, but the concept is care enough to investigate, care enough to think that this isn't just a human body in the chair for that hour. I got to get through it. I got to stay on
Hold on.
schedule.
I do want to change that. It's just a human mouth laying in the chair.
Oh, yeah, that's
That's
true.
how
We don't
they,
even think of the body. You're right. They take the mouth out of the body and
yeah.
it's just the mouth. We should have a dental chair with just the mouth.
That should maybe be our little logo.
It should. I think that should. But it's sad because the service, the sad part is the person that suffers is the patient. Every time their
Every
quality of
time.
care goes down, and they think they're there getting a high quality of care because they made an effort to get into that environment. And I really want to educate the consumer to have a bucket list and interview these dental practices. Do you do this? Do and a list of services, just like you would going to any other service industry. Even, I mean, I think people do it more for mechanics than they do for the dental office. They have their expectations of how good is this and how good are you doing these types of services on my car, but not their body. And I think it has to do with educating the consumer and educating the offices, the practices, so that
Yep.
they are aware that they've got to bump it up, bump up their game. I saw one podcast of a dentist, and he has it weekly with an ND, a naturopath doctor. And I thought, well, there's a
Oh, that's
beginning,
cool. Yeah.
so he's aligning himself with a naturopath doctor on a weekly basis. And where's the hygienist? Why isn't she aligning herself on a weekly basis with nutritionists or interviewing different people? It's this perception that dental hygiene is a necessary evil. But it also brings in money for the restorative department, and therein lies the bacterial dental office. And we know that there's three biosystems: biochemical, biomechanical, and bioelectrical systems that need to be addressed. We are taught about them in hygiene school. I was, but I didn't categorize them. I didn't really
Right.
analyze them. I was mainly a bacterial hygienist graduate. It wasn't until I took more courses with the dentist on the biomechanics and just kept learning. I think the sad part is a lot of dental hygienists like the paycheck and stop learning and just do their continuing education credits for socialization. And that's it. They don't think there's more. But there is, the mouth is medical. I don't care how much you want to, it is a medical place that is the most
Part of
important.
the body. And if
Yeah.
it is out of whack, the rest of the body is likely out of whack somewhere too. Some parts of the body will be out of whack and show up in the mouth, and some mouth things will show up in the rest of the body. So it has to be included. This is my biggest worry with this new NIH director and the whole Kennedy thing. He's got a list of MDs that are like ready to go and all this stuff. I'm like, where is the mouth? Nobody that you picked is looking at the mouth. And if that's not part of it, you're not addressing everything, because this is where all of health starts, in infancy.
Even in embryo,
Yep.
the mouth grows first in embryo before the brain. So isn't that interesting? That's like
Point.
having a car without a gas tank. And then they say, well, you can put a battery in it. You still have to put something in it to make it
Yeah.
run. And the mouth makes the body run. If we didn't have a mouth, they'd have to feed us intravenously, those people in comas. So we have to have some kind of nutritional gasoline, if you will, coming in. Even the way the teeth and touch each other. This dentist in Japan I was mentioning to at another conversation with another hygienist, just the way the teeth touch each other and the sensitivity in the chewing is measured in the brain. So I say to people, have you ever been at the beach and had sand in between your teeth and you can feel that sand? Well, how small particle is sand? Now you're seeing how sensitive our receptors are in the mouth that is being ignored by the medical profession, and even the dental. They're just ignoring all the medical applications. And I believe it's changing because some of we went to last year, IOMT, wasn't it? IOMT, they were talking about these dentists came out and they were so excited about becoming dental physicians. That was the buzz, but there was no way to learn it and become certified. There were no courses in it, and there were no systems that they could put in place. This is where you and I are talking about helping these offices put in dental physician services, and then getting them into a level of knowledge and taking them out of drill, fill, bill.
I
Just
was
my
just going to
thinking.
say, because if you use the term dental physician, it sounds like these dentists are going to have to go back to medical school, and that's not it at all. It's the
Mm-mm.
same as a nephrologist. He or she is still an MD. They focus most of their attention on the kidneys and the kidney tubing, and not the whole rest of the body. They know there's an interaction with the rest of the body. My kidney stone doctor's like, you have to take these pills now because your diet is just not helping to modify the acidity in your urine, and that's what's causing your stone. I'm like, oh, fine, whatever. So that's the limit. That was the limit of his education. It's like, what pill to give you for this problem. He didn't say talk to so and so, or talk to such and such, or watch this YouTube video. None of that. It was all about his little kidney bean. And the interaction then with other professionals is up then to me as a patient to go and find the right person and stumble around in the dark. And that, I hate that. I really hate that. And that's what I'm fighting very hard against, and what you are fighting very hard against. We both have this, I don't know if I want to call it a program, but this intention to bring all of, at least a pod of providers together with the same focus of optimized health, with an not even just an understanding, with an honoring of other licensed professionals who can support the whole being, and not just do, one little wrinkle of it.
Well, that's what Dr. Fonder's book talks about in detail. AC Fonder, he's since passed away, the dental distress syndrome. He in, he
Yep.
totally goes into detail about this need for communication, cross communication with all the professionals and treating the whole person together as a team. And that's what we were talking about, is the team approach. If we're going in that direction, and like you said, you want a team to help represent your case and why the kidney stones were there, what caused them.
Yeah.
And you can investigate using different technologies that we have now. I mean, people are crazy at these wellness centers going in and trying to find out why they have what they have or where their health is at so that they can get some kind of peace of mind. Or they have a pain and that drives them into a wellness center because they don't want to go to a hospital ER. So they'll go to a wellness center and lie on these red light bed therapies and have results. Then they tell their friends and they tell their friends and so on and so on. And it's taking off. These wellness clinics are taking off like crazy all over here in Las Vegas. I can almost on every other block, there's wellness clinic. And I know why. It's because, like what you just said, people are searching for answers and they don't want to take a pill anymore. They're tired of the prescription and treating the symptom and not the cause. That said, a team approach is going to have to be put in place to find the cause.
You can lay in a red light bed for what did you use to do at that place that you were at? It was like a package
The
of
most was 12 minutes.
visits.
Yeah, 12 minutes, 12 minutes to 20 minutes, but really you can overdo it.
Yeah.
And people were overdoing it,
And
and
you
it
have
was
to
not.
do it once a week, or how often were you?
She would sell packages. So she would sell them in, 12 visit packages up front, and they would come once a week. Some people came twice a week. In the beginning they had results, but there was no one regulating them. There was no one overseeing the care to say, all right, let's look at how well you're
Patient was
progressing.
stuck trying to do it themselves.
They were on their own. Yeah. Just blindly going into these equipments. It's not that the equipments work, but there's no guidance. So you have to
How
have.
best to use it, right? And then you're like,
Yes.
oh, well, I did all my research. Really? You went to PubMed and you dissected 14 papers, and now you know what to do with this, and you're just going to come here and just lay in this bed and you're going to expect the whole world to change for you. um, they don't know what they don't know, and that's why you need to have somebody besides just the the facility owner.
Oh
The
my,
facility
don't even
owner.
get me started on these
Yeah.
facility owners. I've been in enough to know that they don't know anything about
No, they
them.
just know people like these. They're looking for these red light beds. So I've got one, and they're looking for vitamin C infusion. So I got a nurse.
No,
They're
they don't
looking
even have any kind of professional provider running them, Shirley. These are just
right.
people that off
They
the
don't have a
street.
medical director. They don't have a dental
No, oh
director. They
no,
don't have a
not even
dental
close.
hygienist
They don't
director,
even, they don't
and
even.
they're not required. It's
No,
weird.
and they're not even required. There's your licensing we were going to talk about.
Yeah.
Where's the licensing for this? Where's the regulation? Where's the conversation? Who's the leader in all this? It's the wild, wild west. And these wellness centers, unfortunately, a lot of these people are getting paying thousands of dollars. One person paid almost $3,500 for a wellness visit. And she didn't get what she expected, and she was very upset with me, not with me, but she was expressing her upset with that she had to spend that kind of money, and the person was not qualified to go into all the systems, and she was not practicing or providing services that was integration. She was just come to my center, use my service, and that's it. And it's $3,500. And, go through these
Yep.
frequencies assessments. Now, the frequencies assessments have their place, but once again, everyone's bouncing around and they're not getting their answers. And
Still
more
silos.
yeah, and more often than not, I can guarantee you they're not looking at the dental portion contribution of their illness. And that therein lies why they're not getting any answers, because they're not including dentistry in the wellness centers. Dentistry alone is not so much dentistry. I just want to call it medical mouth care. The medical mouth care is not being addressed. They're doing the medical care of the body, but not the medical mouth care of the body. And that is where most of the problems can be caught early, treated early, and seen early in the body. And there's no understanding about this connection. It's difficult in the bacterial office dental program business model to explain it. And you and I are frustrated as all heck, but I know there's good news. There's dentists that are really seeking answers. They want that, if you call it wellness dentistry or
They're
integrated
trapped
health.
in their license
Yes.
because they do, especially the holistic crowd, the holistic dental crowd. They are in the IAOMT that we were at, the International
But what, yeah. Uh-huh.
Toxicology Group.
Yeah.
And so they do know, because they have been studying outside of their scope of practice, let's say, because their scope of practice is the whole body. So it's just hard to stay right so narrow in there. So they do know, they do understand how the teeth have these electrical currents. There was a speaker, I sat in his course 2 years in a row because he had tied psychological problems with dental tooth decay. If you have a problem with your dad in the last 2 generations, right? So he was going 2 generations
Yeah.
back.
Right.
You're going to have a cavity on this tooth, on that side of the tooth. That has been identified and proven. He's got whatever for each tooth and each surface
Current,
of each
the
tooth.
frequency. Right.
It's unbelievable, right? So that's the holistic dental crowd. Sounds a
And
lot woo woo, but
no.
it's exactly part of the entire equation.
Well, how come we can say when your eye whites are yellow and they perfectly accept that it's liver? The liver's not even close to the brain.
Well, you can't make a diagnosis because you don't have the right letters after your name. You can say it looks as though your liver may be affecting or be affected in some way, because I noticed that your eye whites, or yeah, your sclera of your eye are not white enough or this color enough. You have to use really couched language or people get all twisted up.
Maybe that's the problem.
Oh, yeah, language is part of the problem.
And twisted up, and they get easily in the scope of practice. Who invented it? Who took the mouth out of the body? Who took, who segmented the body? Is it the educational system? Is it the drug industry? I mean, our body is dissected in so many segments that I had to smile. I drove down the street here in Vegas and it says wellness gynecology clinic. What's so wellness about gynecology? I don't know, but they think it is.
Yeah.
So, and I, go for it. If they're going to, offer services in a more holistic environment for the women, and I'm just looking at this as saying, where is the communication? Where can we increase the community? We've got digital. Where can we increase the education and the communication so that we're speaking the same language and not creating this fear of saying the wrong thing and being
Yeah.
bullied about our license and losing it. And I know dentists that have lost their license for talking about systemic issues. Oh my goodness, why? And that's where they need to really, revise this business model. It's so old. It's
Yeah.
so old.
It's so old. And that's what I'm trying to do in my practice at Primal Air. the intention is to help chiropractic offices and dental offices incorporate just looking at the soft tissue in the mouth as contributing to dental problems and chiropractic problems and airway and sleep. And it just kind of keeps on going on and on. But you first have to say, hey, what's going on in your mouth? We had that just happen a couple weeks ago. A new chiropractor opened a practice one city over, came over. So I showed him all my stuff. He's like, wow. So he has a patient right now who is not accepting his adjustments. And finally he was like, can you do this? And she was like, she couldn't do it. She's so tongue tied that her tongue will not go up at all.
Uh-huh.
So that's what's been going on with her. And that was a big find for him. So we're just working out the kinks on how to do that together. Just knowing to look there. We also have developed with the chiropractor, Dr. Samuel here, and I went to a conference in California a couple of weeks ago, and we had a lot of driving time and we built in time for business planning. And she said, you know, I loved the most when I was doing my residency or internship or whatever rotation through the VA hospital. And I was like, you've got to be kidding me. I have zero good things to say about any experience I've ever had with the VA hospital. And then she says, yeah, every day on the fifth floor, all of the providers would get together and they would share information about all the findings from all the patients that they shared.
There you
I
go.
was like, dang it, that sounds awesome. Where was that in 1980, whatever, when I was at the VA hospital and I watched this dentist drop this old man onto the floor? It was really bad. And so that's what we came away with, that we've come up with a name. We're calling it Kaleidoscope Care. We already have a group meeting once a quarter where we have a lot of different kinds of providers to just talk and understand, where each one is coming from. How would you do it? How would you approach it? I would approach it this way. Did I do my part wrong? How does my part affect your part? You can't just stand there and say, I'm the smartest one about these things. You have to go, well, if I did it this way, would that negatively affect your treatment or your plan? You have to be open. You have to be vulnerable in these situations. And so far, nobody has taken anybody to task about anything. It's just really about learning and working together in the best possible way.
Well, the best and the easiest form of communication is using thermal imaging because it
And your
shows,
software, it
yeah, and
puts
the
it
soft,
all, yeah.
it really accumulates the data for all the providers and they can see where their part is instantly. And the nice part about the software features is I have a provider link in the software that the providers can all click on the link and in a live view, click on the images, click on the 3D imaging anatomy software, which most of them don't have. They don't have any of that to overlay
Right.
those therms to see the rotation in the body and see, and then take and then adjust the temperature of the overlay to see exactly where it's stressing the nerves. That's what's contributing to the shutdown or the over stimulation of the organ. And it's so crystal clear. So that's why you use it as an investigation tool. I built it that way. I didn't build it to use it as a AI. Press it, it will tell you everything. I used it for, like you just said, a group of people to get together and input. Humans talking with humans.
What?
Everyone talks about
Yeah.
AI. I think AI will have a place. I won't say it won't because it will help kind of hone in the areas for specificity.
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 Yeah. So, and that's a really couple of
Specific.
really good points there, because I was just thinking as you were talking how we all just work with tissue and bone, and we've spent thousands of dollars to know how the cells work, and then we get out of school and we never think about the cells again. We had a patient that was in a lot of pain. She was looking to me for solutions, and I gave her a solution right out of the gate. And I was like, if you're drinking spinach smoothies, you are very likely highly exposed to oxalates. And I would encourage you to get rid of all of those for the next week and a half, 2 weeks, and see if you feel any better. Her pain was down over 50% by that one little thing. Now, AI software would not pick up on that, I don't think. You would have had to put in all kinds of weirdo little bits of information
Yeah.
that you wouldn't think to put in, but through casual conversation, this came up that she was on a plant-based diet, and usually that means you're drinking a salad. So,
Well, and what people don't realize is that the liver, when you look at filtration in the body
yep.
and the pain that is when there's backup in the filtration in the lymphatics, what's causing it? That's why when I take these images and I have the different appointments spread out so that even for the dental practice, we can have it. I have it I think this is going to be the future. Take the images, upload them in a Dropbox. We'll do the investigation at another
There you
location,
go.
send it back to you. Because to take the time in that appointment to do the investigation, you could easily miss something and you're, being pushed to stay on schedule. So what we're thinking of changing the model so that and eventually, this is my thinking, the more they see the reports, the more they start to learn to recognize those areas. And eventually they'll be able to do the investigation within that hour and not have to send it out. But in the beginning, I say, put a camera in your room, put it 2 or 3. I mean, take those images, put them in there, and with the introductory of what the person is and all kinds of little questions that's in the software, then have them back for a
Yeah.
consultation after the investigation's done at another location. And then I would like to recruit those who are interested in taking those investigations. There are people that want to work from their home and they love investigating and why things are connected and the science behind it. And they have that training. And so there you have it. The patient gets, the satisfaction of both services. And the dental offices, we talk about tradition. They freak out when they have to think about taking time to investigate. It's like, well,
Don't
that's
have
out of
time.
our routine. And I
Doctors
spoke
are the
with it.
same. They have less than 10 minutes to talk to people.
Right. Yeah, I
So,
spoke with a dental consultant. We looked at the percentage of dental practices in his group that he consults. He puts systems in place. He's very popular. He does this, puts your business together and your billing and all your productivity projections. And the dentists hire him for probably, a few $1,000s, right, to come in and put the systems in place. We looked at the map and said, well, how many of these dentists would want to add investigation and add a science investigate and the prevention program? And he said, probably, and we looked at the map, 1% would be interested. 1% out of what he's been doing so far for so many years, he couldn't see, but he was open-minded. He said, you know what, Victoria, if we can, I'm open. If you can find a dentist that is interested in putting investigation into his business, or her business, let's, bring her on and we'll have a conversation about how to create
yeah.
those systems of investigation and bill insurance for it. So I think where dentistry has lacked all these years is taking the time to investigate, and healthcare, no investigation. You need the investigation portion, and the dental hygiene profession couldn't be more perfect, better than nurses, I believe, because we have the medical mouth background and foundation and the body. So why don't we get the training for the dental medical investigation portion of these businesses to create these reports, and get a break from, the bedpan scraping, I call it, you're just manual labor. Why don't we use our cerebral thinking and critical thinking in this, put together the investigative reports? And I really see the future shifting. I don't know how, but just like anything, it's going to take time. It's going to take a little bit of explosions here and there
Yep.
in the industry, like you said, to get out of these traditions. And and the articles need to be published about how traditional dentistry is actually hurting our health. It's not helping.
There's an interesting idea to put into like McCall's magazine. Remember that one? Is that still around? An article about don't let your hygienist probe your teeth. Oh yeah, that would go over really big. But it's really it's part of the solution. So if we, as an example, we have our little collaboration meeting, our little kaleidoscope meeting. So each of those providers could input into the same patient base because we're all signed in to your Dr. Links. Is that right?
Correct. Yes.
And then we could hire off somebody who has the time to think their way through the whole package or
Yep.
do it yourself. And then would we each get a report based on
Yep.
our silo, or would it be one report that we would all use?
One report that you would all use looking at the analysis overall of the biosystems. And every biosystem has your own provider services. So if you're an ND, you're not going to be talking about adjusting the atlas under the skull, but you're going to talk about adjusting
But
the
you're
gut.
going to know it's off. You're going to know that it's off.
You're going to know that it's off, and it has something to do with the vagal because the vagal's getting compressed and the stomach can't digest, and the parotid glands. If those parotid glands aren't working, it's because the enzymes aren't being produced, and it's a hormone. And those hormones are off because the thyroid's off. Everything will show connection. And then you say, well, why is that happening? Well, when the teeth chew, these teeth, like Dr. Fonder talks, says vertical dimension. They're not touching each other. This tooth isn't he's not getting any kind of circulation or stimulation from chewing because it has no opposing tooth. It just is gum tissue, you know, or you have partials that don't give the same stimulation to the opposing tooth, you know, or you have a bridge that locks in the ligaments so the two teeth holding the bridge in aren't able to bounce correctly at the same rate because maybe the occlusion is often in the I want to say occlusal. My brain isn't working at this moment, but the
We
closest to the lip.
started to be fair, we started a half hour early today and with
Thank
like
you.
0 minutes notice. So I
Yeah,
appreciate that you have, maybe you didn't have your green tea or whatever
yeah,
this
I didn't have
morning.
my MTE. Yeah. Well, I'll tell you, it's really amazing how important our thinking is. And you think about it, we're providing services at early in the morning. How clear is our thinking when we're in an environment? But I'll tell you, the amount of little I want to say the little worker bees that go on inside the medical mouth all have their function. And so the providers using this report will see where the deficiencies are. And here's the best part. When do they come in for their care? And that's where I believe the patient has to regulate that phase of care because if the patient says, I don't have any stomach problems, but the stomach problems show up, but I have pain in
Yep.
my neck,
Yep.
well, we're going to show them that eventually you will have pain in your stomach because the thermal image shows that you've got
Yep.
stress in that area. You just don't feel it yet. But in the neck, it's very heated up. It's very stressed. Let's start here. And then now the patient has a map. They go, oh, I see. Okay, well, I want to prevent. There's their values. Okay, I'm interested in getting in a program of prevention. And this is where it goes back to the business model in the dental is right now the person comes in, they have no control, right, Shirley? They just sit there and they have to be told everything that's wrong, everything they're not doing at home. It's such a negative environment. There's no healing. It's almost like, you've got this problem car wash situation and they're treated like car wash. They're not looked I had to smile. This one dentist doesn't even put him in a dental chair when he does his assessment. He has a talk with them in a lobby or that
Yeah,
office environment where
in a
there's a couch and a
consultation room.
chair. What a concept, instead
Yeah.
of coming in a white lab coat, he's sitting in and they kind of are calmed down and they can and now you're going to get more, they're more on board and they believe you care enough, the
Yeah.
trust. You're not insurance based. And believe me, people find the cash. I don't think the dentists understand. They will find the cash if they know you care and you can help them. I don't care what level of income they are at. I have seen it. They find the cash.
because they believe it, and
Yeah.
they're so tired of shoving money or using insurance money to pay for stuff that doesn't work. Their uncle did it, their brother-in-law did it, the neighbor did it, nothing worked for any of those. They don't want to go down that road. They want to try something that makes more sense, that's a little bit easier to digest. Which one of the things that that your software would really solve is this idea that if we had, I mean, we've got, oh, I'm just changing all these subjects.
That's
We
okay.
have like all of these empty malls right now, right?
Mm-hmm.
Tons of them.
Oh, we
So
do.
we do. It's perfect. And you have smaller malls that I noticed when I came to visit you last time, where there's maybe 4 stores that are all closed down.
Right.
So these malls, ours are gigantic here in Wisconsin. They have room for like 70 different stores. But if one was just radiology, one was a radiologist,
Right.
one was a store of just supplements that is run by a person that understands supplements, a clinical or a dental store run by a dental hygienist, where you just have a higher level of expertise to help guide patients to the right thing,
Mhm.
including supplements. That you have a place for the CSA, you know, when you buy a piece of a farm and they come and they drop off everything. That would be awesome. A dental, a classical dental, a no drill dental, a dental hygiene treatment, an airway treatment, you know, whatever these doctor parts, imaging. Well, the imaging would be in the X-ray, and then there's an ENT cross.
Investigation. Yeah.
Yes, so that all of these licensed professionals, we have a license to protect for a reason, and we all understand that our license has stupid limits. I think everybody that has a license is like, why do I stop there? We're all working in a shared domain. And I used to think that that was like the ENT, the speech language people, dental hygienist, and myofunctional therapist. We're all in this. But the domain is the human body, and we're all working in a shared domain. And we really do need to communicate better. So, what better than taking advantage of some of these already built things, repurpose them where all of these professionals can get together, like Dr. Samuel was expressing at the VA. And every Thursday, we all talk about all of our patients who we've been seeing this last little while. We all have the same point of view, right? We are all in the same lane for the benefit of the patient. And
Hmm.
if the ENT is like, oh, well, the sinuses are blocked up, and because these, those, and the other things, and I can say, well, you know, the sinuses are blocked because the arch is too tall and it's taking up the space, and that's because the tongue is in the wrong place and it's leaning back into the airway on top of it. And then the dentist can say, I can expand the arch. Which of these do we think should go first? Wouldn't that
Well,
be cool?
yes, and one of the things that you're leaving out is the patients in the driver's seat. What?
Exactly. They don't have to go searching for high and low for their
Right,
professionals.
right. And they're heard, they're listened to.
Yes. Mm-hmm.
What's your chief complaint? And I divided in the software 2 areas of medical and dental complaints. And what's your magic wand? I use the magic wand only because it's an easy understand real quick that if you could change anything about your dental health, what would it be? If you could change anything about your medical health, what would it be?
Yep.
And usually it's cosmetic. It's not their complaints.
Yeah.
But I can use the cosmetics to address the complaints. So if they have yellow teeth or gray teeth, that could be poor circulation or diet. So let's look at, the cause of why you want the cosmetic. You want to lose weight. That's your magic. You're over. Well, what caused the weight gain? Or how long has it been in the body? What are the circumstances around it? And I think having a group of people in one location discussing the causes of where what the person wants changed and how to change it is going to be a stronger commitment for the care. A lot of
Right.
times people will spend the money up front and then you don't see them anymore, because they didn't
You
feel
count on
part of
that.
the process of
Yep.
being involved in the deciding factor. And I see that in healthcare industry. We are looking at empowerment with the consumer. And and they kind of look at me funny and scratch their head and say, well, you're the expert. And I said, you're hiring me for information. You're hiring me for the service. You're your own best doctor. You're in charge. Put the responsibility back on them. Um, the three largest lawsuits for dentistry right now, what do you think they are?
Well, periodontal disease is always in there.
Actually, it's not.
What
The
is it?
first,
What
the
are
number
they?
one, yeah, the number one is extraction
Wrong
and
tooth
then
extraction or
tooth
impartial results?
extraction. Tooth
I know, but
extraction.
what about it?
They sue because they have side effects.
Oh,
And
okay.
they weren't in the environment wasn't as medical as it could be, right? The second is root canal failures. And the root canal failures, there's lawsuits there. Then the third, believe it or not, is implants. So we're looking at the three highest lawsuits that consumers are now they're becoming compensated for. How is the dental going to protect themselves? It's all going to be from the medical mouth, coming from a medical mouth versus tooth. I'm just treating a tooth. No,
Okay.
you're not. You're treating a part of a body part. That's like saying, I'm just treating a finger. I can pull it off. It's not going to affect the other ones. Yes, it is. It's
They'll
like
still be
they
able
don't
to go
realize.
like that.
Yeah, yeah, and we've seen people, they go, I only chew on this side because I don't have any teeth over here. I just chew all the time on
Yeah.
this side. What's it going to do to their airway? What's it going to do to their throat and their also facial nerves and their vision? It's going to affect, oh my gosh, all the nerves. And then they wonder why they have a walker eventually, and then their hips. Then they're told you need a hip replacement. All because they're not chewing on both sides and they're not swallowing. So they're going to replace the hip. I mean, isn't that crazy?
You know, when you say it like that, it's really obvious that it's crazy. And then the other, thing is that we do have solutions and we're really close to the end of our time. So, for me, it's this collaboration meeting and getting together, and working together and communicating on shared cases. That to me has been ideal. And then using your software is also part of that. So what do professionals need to do to get in touch with us to get them into that next level?
I believe they've got your website to contact you,
Yep.
which is primalair.com.
.com. Yep.
And I have my website to get a hold of me, and that's drlinks.com, and that's linxs.com. And there's no dot after doctor. So drlinks.com, and put something in the email in the contact and just say, we're interested. Shirley and I will put together a business model that's updated 2025. Go
That'll
figure.
work for you and
Yes,
your
customized.
area. Mhm.
Yeah, we will, because and we even have contacts and networks for the billing. I do. I know Shirley, you do too. So cross-code billing. If they're putting medical billing inside of dental care, what does that say? There's got to be some kind of discussion and communication, because it's like they're dipping their toes in it, but they're not really getting into the water. They're just dabbling, well, we'll help them jump in the pool, because, well, that might scare a lot of people, but help organize,
And they
systemize.
they just can't be afraid. You cannot be
Yeah, that's
afraid. If
true.
you have a license to protect, you need to you can
True.
do better. Just really wonder, is this the same thing I was doing 5 years ago? And if it is, should I still be doing it? Just start with that. Just start with that one little two-part question and wonder aloud to yourself and to the team you're working with, if you really are optimizing, or are you just barely treading water? I remember too when the caries management by risk assessment was just coming onto the scene, and these doctors were like, stop screwing around, just get the drill out and get these teeth fixed. And then the new graduates would be like, no, we have to manage the bacteria first. Speaking of going back to that, the full circle there, it still needs to be managed, but it's got to be managed from the interior. It's got to be managed from the interior.
Amen. And there we go. And the closing statement is, no,
Open wide.
open wide, open to upstream. Don't be afraid to swim upstream. We have a boat for you.
That's right. And we are entertaining all kinds of questions in the chat if you'd like.
Sure.
That's another easy way to get in touch with us. I do get notifications from YouTube and not yet from Rumble, but that'll work out too. So I really appreciate your time, Victoria. This has been continues to be fun, and I'm looking forward
Yes,
to next
definitely.
Saturday.
All right. Well, hope we see some questions come in this week, right?
Yeah.
All right. Have a good one.